warahmatullahi wabarakatuh. The article for this week titled as Outcome of Non-Surgical Root Canal Treatment of Teeth with Large Apical Periodontitis Lesion. This study was published in the Journal of Endodontics in 2024. The research was conducted by Artaza, Sequeira, and others. Let's start with a quick introduction. The size of the lesion often reflects the complexity of the infection. Larger lesions, particularly cystic lesions, can present more challenges in terms of treatment. However, previous studies have shown mixed outcomes when treating large lesions. Some studies suggested that larger lesions are harder to treat, while others show no significant difference in the treatment success compared to smaller lesion. The objective of this retrospective study was to evaluate the success rate of non-surgical root canal treatment or retreatment in teeth with large apical periodontitis lesions. The study also aimed to identify the factors influencing the treatment outcomes, such as lesion size, history of abscess, antibiotic use, and the presence of sinus tract. Let's move on the material and methods used in this study. This was a retrospective study that included 199 teeth with large apical periodontitis lesion from 184 patients aged 10 to 85 years. The inclusion criteria focused on teeth with a large apical periodontitis lesion defined as those larger than 5 mm in diameter. These patients either had necrotic bulb or had previously root canal treatment. For the exclusion criteria, teeth with periodontal pockets greater than 4 mm or patients with significant systemic diseases were excluded from this study. For the follow-ups were conducted periodically from 1 to 8 years post-treatment. Radiographs and clinical assessment were used to evaluate healing based on pre-apical index and CBCT in selected cases. Patients were categorized as healed by mean no signs of apical periodontitis, healing, reduction in lesion size, or diseased, persist, or enlarged lesion. For the outcome, criteria for success were defined under two categories. Loose criteria, where both healed and healing cases were considered successful, and rigid criteria, where only healed cases were considered successful. Moving to the results, the study found that non-surgical treatment of large apical periodontitis lesions had generally favorable outcome, with a success rate of 89% under loose criteria and 67% under rigid criteria. But retreatment, the success was lower at 79% and 47% respectively, with factors such as previous abscess, antibiotic use, lesion size over 10 mm, and presence of sinus tract negatively impacting success, particularly in cases evaluated using CBCT, which revealed a higher failure rate due to sensitivity in detecting complex residual disease. For the conclusion from this study, conclude that non-surgical root canal treatment and retreatment of teeth with large apical periodontitis lesions can achieve high success rates. However, certain factors like abscess history, antibiotic use, and lesion size, especially over 10 mm, might negatively impact outcome. Thank you.